Hi everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about kneeling and how to progressively increase your tolerance and ability to kneel after knee replacement surgery. Hey everyone, so today we're talking about kneeling. And kneeling is probably one of the more difficult, if not the most difficult thing to do after knee replacement surgery. And the reason for that is it can cause a lot of pain and a lot of discomfort and sensitivity when trying to put that pressure on your knee in that kneeling position. So you're bending the knee quite a bit, and then of course you're putting that direct pressure right on the front part of your knee, which can be very uncomfortable and very painful. So a couple things to keep in mind is one, your knee replacement, your new prosthetic, is 100% able to tolerate the stresses and the forces of kneeling. So there's very little risk compared to anything else and everything else you do in your day-to-day activities. Kneeling has very low risk of causing any type of damage or injury or loosening or problems with your knee replacement. So that's something to keep in mind. What it's going to come down to really is your ability to tolerate being in this position. So decreasing the pain, decreasing the sensation of stiffness, and decreasing just that sensitivity of the knee and of the leg of being in this position. So I want to talk about a couple of ways that you can kind of progressively go from not being able to kneel to being in this position where you're down, kneeling on that one leg. And really it's going to start from progressing from something that's easier to something that's harder. And I'm going to show you a couple of ways to do that. And then what you want to do is set up a plan, set up a way that you're going to progressively do this, maybe over a week, 2 weeks, a month, whatever it may be, however long you need to kind of progressively be more and more comfortable with getting down on that knee and kneeling. It takes practice and it takes kind of progressing in difficulty, just like many other things that we talk about on this Need to Know show. So the first thing you can progress is how high you are. So obviously getting all the way down on the ground to kneel on the ground is going to be your most difficult thing. But why don't you start with a surface that's higher up? So probably the easiest thing you can do is if you have a chair or if you have a sofa or a bed that's a little bit higher. Those are really good options. So obviously this chair is hard, so I'm just going to put a pillow on top of it. And all you're going to do is you can hold on, or if you have something else you can hold on to if needed. And you're just going to bring that knee up as best you can. You might have to do it a little bit of you might not be able to bend up all the way. You might have to do a little bit of an angle, which is okay. Just adjust as needed. And you're just going to come and you're just going to kneel. And probably initially you're not going to put that much weight on, but you'll start to put a little bit more, start to kind of shift that body weight. And just hold it as much as you can tolerate and then ease off. And then as much as you can tolerate and then ease off. And then you can set a goal for yourself. Say that I'm going to kneel on this for 2 minutes. And then if you're able to accomplish 2 minutes, then up it to 5 minutes. Usually about 10 minutes is the max that I'll have people go, but just think about that. So that's the other thing that I'll show as I'm going along is you can progress the time. Start with maybe 30 seconds, trying to kneel, trying to put your body weight on the knee, and then come off of it and relax for a minute or two. Once you get comfortable with 30 seconds, the next day or a few days later, now try for a minute or 2 minutes, and then you progressively increase the time. So again, so now you're starting at this high surface. Maybe this is a chair, maybe this is a sofa, maybe it's a bed, and then you want to progress a little bit lower. So you can be really creative, but basically anything that's lower than the first surface but higher than the floor. So I have this little stool. Again, it's firm, so I'm just going to put a pillow and then just practice leaning on the stool. And again, start low, start with a minute maybe, and then progressively increase how long you can tolerate it. Maybe go to 5 minutes, 10 minutes, usually is about the tops. So progressing to a stool. And then if you have another thing you can progress down to, maybe it's a stair, whatever it may be, you can progress a little bit lower until eventually you're down on the floor, kneeling on the floor. Now the other thing, so we talked about height, going from something higher and then progressively getting lower and lower. We talked about time, so starting out very low amount of time, short time, so 30 seconds, 1 minute, and building up 5 minutes, 7 minutes, even up to 10 minutes if you can. And then the other thing you can progress is the firmness, the softness or firmness of what you're kneeling on. So, for example, here kneeling on this stool, I can kneel on a nice soft pillow. So I can put 2 pillows, I can put 3 pillows, you can put as many pillows as you want to start out. And just kneeling on the pillows. And then to progress that, take 1 pillow away. So I had 2 pillows, now I'm down to 1 pillow. Maybe you started with 4 pillows and you progressed to 3 pillows and then 2 pillows and 1 pillow. However you find the easiest for you to do it, as long as you're progressing and making it a little more challenging every time you try it. So now we're down onto 1 pillow. Something else that is very useful, you could use sofa cushions, couch cushions, that works very well as well. Then you can progress to having a rolled up towel or a rolled up article of clothing, some t-shirts. You might progress to then using a yoga mat that's maybe folded over a couple of times. So you're progressively getting softer, a little firmer, but still relatively soft. And then you eventually want to progress to the point where you can kneel on a carpet. So a carpet obviously gives you a little more comfort, a little bit softer than a hard surface. So that would be kind of that last progression. And then if needed, if that's your goal, you can of course progress to then the hard surface is going to be the most difficult. So kneeling on that hard surface, putting your full body weight through it all the way down, and then holding that for a prolonged time, that's going to be the most difficult, and that's probably going to be, for a lot of people, your goal eventually. So just to give a brief recap, kneeling, you want to start easy and make it more difficult. So you can change the height, start up higher using a seat, a sofa cushion, a bed, progressively get lower and lower till you're kneeling on the floor. You can adjust the time. Start with a short amount of time, 30 seconds, build up to a minute, 2 minutes, so on and so forth. You progress the surface you're kneeling on. Start with a bunch of pillows, a bunch of sofa cushions, progress, take one away, change to a rolled up towel or some clothing, progress to a yoga mat, whatever it may be, and then progress to a carpet, and then the hard surface. So set up a plan and try your best to stick to it. Make it long enough that you can progressively get to that point, get to that goal. I encourage maybe 2 weeks, 4 weeks if you need to. Work up to it slowly. That's going to be the key to kind of decrease that sensitivity of just being in this position and putting that pressure on your knee joint. This has been the Need to Know Show. Thank you very much for watching, everyone. If you enjoy these videos, be sure to subscribe. Click that button in the lower corner if you're catching this on YouTube. And as always, we post every day. I appreciate any comments, any questions. It helps me help you through your knee replacement journey and having a successful outcome from your knee replacement journey. Thank you very much for watching, everyone. Have a great day.